At DBHR, we think a lot about all things having to do with mental illness and with substance use disorder, health promotion, and prevention of substance use problems. So we work with everyone from small school children in our prevention programs to people with very serious mental illness and substance use disorders. I think our theme across our whole system is people recover. People can recover and be successful in their communities and in their classrooms. So we work really hard to keep recovery as a centerpiece of our services.
So this has been a long time coming, I think 4 or 5 years in the making. And what's really critical about bringing together behavioral and physical health is to create an opportunity to provide wraparound services to the people of Washington to really support the health of the whole person. And this is something in public health that we really believe in and believe is an integral part of making our healthcare system work.
DOH has a long time specialty in licensing providers. It's how they help assure the quality of services across our system. So we have a small licensing unit that works with mental health and substance use disorder providers. It makes perfect sense for them to work with DOH, who has a much larger licensing function. So we'll bring the knowledge of mental health, and DOH has an infrastructure that can support our employees who do licensing and CERT.
We're providing the people of Washington a safe, secure place to go get health services because we know that being able to access health services is one of the most important things in order to be healthy.
Before I joined the Healthcare Authority, I worked at Seattle-King County Public Health, and before that I taught in a family medicine residency program that was a family practice program. And like there is now, there were different criteria that clients had to meet who were on Medicaid in order to get mental health services, and there was never quite enough treatment slots open for people who had substance use disorders. So I may see someone in my practice who had a serious mental illness, but because they didn't meet the exact criteria, they couldn't get help from a psychiatrist or get the right medications. And because Medicaid traditionally is not paid as well as other insurers, you couldn't find anybody to take care of them. So, we do the best as primary care providers trying to manage that person. And I think time and again you can rearrange the order of the problems or the story that someone might show up with, but we have grown up as a healthcare system with 3 separate systems. A system for the medical care, a system for the substance use disorder care, and a system for the mental health care. And people are not, people are clever. They figured out that it helps clients better to integrate those as best as you can. And people have sought grants in different community health centers and mental health centers across the state and figured this out long before. But what we know is that when people have fewer barriers to access the care that they need, the more likely they are to get that care, the more likely they are to enter a sort of state of health where they're better able to manage all the other problems that may be contributing to their underlying illness.
When you think about mental illness and you think about substance use disorder, these are, at their basics, they're medical problems.
We're really excited to have the opportunity to bring all the employees together who do this work. I think it gives us an opportunity to create a better community of practice for the employees. I think it provides us with the opportunity to look at our work and maybe assess how we want to do our work in the future and combine opportunities and ideas together. And that's really exciting. We can't wait to have the new staff join us and to think about how we can take it to the next level once we have everybody here.
The opportunity for our agencies to work together in a different way is unique, and it allows us to think differently and to sort of really take a step back and say, here's the way we've always done things. And we've got all the right people in the room to say, is that really the best way? Is that really the best way for the client? Is that really how we best serve their needs? And if it's not, then we've got all the right people in that same room to say, no, why do we do it that way? Maybe we should think of it this way. So to me, this is a tremendous opportunity to really take a step back and say, Have we built what we wanted to? And if we haven't, what do we need to do to get to what we want to see?